The Ghana Health Service has exceeded the World Health Organization's goal for births attended by skilled personnel, with 90% of live births now being delivered by skilled midwives. There is more in the following report by our Central Regional Correspondent, Calvis Sete.
According to Dr. Patrick Boaji, the Director General of the Ghana Health Service, the organization is working to meet Sustainable Development Goal 3 targets by significantly reducing maternal and infant mortality rates. To achieve this goal, Dr. Boaji mentioned that the Ghana Health Service has improved the number of skilled midwives nationwide and upgraded various health facilities. Speaking to Citi News at the 4th Annual General Conference of the National Association of Registered Midwives, Dr. Boaji noted that the Ghana Health Service has surpassed the World Health Organization's standard of 6 to 7 midwives per 1,000 live births, with 13 per 1,000 births delivered by skilled health officers, accounting for 90% of live births.
Not only are we making sure that welfare is catered for to the best of our ability, giving them the skills and also giving them an opportunity to expand the scope. Previously, where midwifery was no, but now they can move all the way half to the degree into the postgraduate level so that improve the quality and skills that they offer into the table. So those are the things we are doing. We've also been able to, the number of midwives have increased to the extent that we have actually exceeded the WHO norm of 6 to 7 per 1,000. We're doing about 13, so which means that there are more midwives now available for care. And that is why in the last DHS, over nearly 90% of all babies are being delivered by the skilled healthcare, which is an important prerequisite to reducing maternal mortality. It's dropped below 300, the last assessment that we've done. But even if you look at the 1B record, which is also accurate, we've moved in the last 10 years from about 280 for per 1,000 live beds to per 100,000 live beds to about 120, 110. So there's been some significant reduction in that. Infant mortality is quite reduced to under 40. Previously, it was very high, 50s and 60s, so it's quite low now, and it continues to come down.
Mary Ofusu, the national president of the National Association of Registered Midwives, called on the government to further enhance facilities and provide necessary logistics to improve the efficiency of midwives' work.
We are doing our best as professionals in the workplace, but the majority lies on the government to provide us with the necessary logistics so that we can work together to achieve the SDG Target 3. Our working environment, the facility that we are working. We are also talking about even the delivery beds. As midwives, wherever I stand, I talk about the delivery beds because we need to get adjustable bed. Look at me, I'm not tall, others are taller than me, some are also shorter than me. We need to get adjustable delivery bed. If you see a midwife who is on retirement, at times you meet the waist before you meet the entire body. It's the way the bed is strategized. We can't adjust it, so you have to adjust yourself to suit the situation. And it's not helping us. We are also talking about gloves and other things that we are working with. That's what, and also motivation for midwives. If you see our setup, now midwives are running away because we are not getting the proper motivation to work with.
Meanwhile, the National Association of Registered Midwives has launched the fund to support its members with cancer infections, aiming to alleviate the financial burden associated with cancer treatment. The association will cover all treatment costs for affected members.
Cancer is a condition that you don't pray one gets into because the cost alone and the pains individual goes through is not easy. Some of the midwives were going through these conditions, but unfortunately they were not coming up. Before they open up, they are at the advanced stage that nothing can be done, and they pass on. Most of our midwives. Cancer is a condition, even though it kills, when it's detected early, there is at least a hope for you to survive. We have welfare fund, or let me say, a dues that we deduct. We also have other fund on our pay slip, so we are using part of it to invest for that purpose.
In collaboration with the Swedish Medical Center, every active member of the association automatically qualifies for access to funds.
The objective of this Cancer Foundation is to save the lives of midwives who may unfortunately get the cancer disease. It's a fund that they're going to contribute to ensure that it takes care of their members who may get cancer. So technically, that's what all it's all about. They are the fifth to join this cancer fund being run by SGMC. So all one would need is to come out with a pathology report that suggests that you have the cancer. And then once you have that one, you come along with your membership ID card or a Ghana card. We'll take it out from there and follow up with the association to seek approval, and then you have treatment. So that's all one needs to be to join or enjoy service from our center.